Mrs. Cross. It's Julie, and I'm here to clean around your tracheostomy tube, make sure that it's clean there, and just take a few minutes. Can you just state your name and date of birth for me? Okay. And do you have any allergies, Mrs. Cross? No? That's good. Okay, I'm just going to wash my hands here. Okay, now to gather my supplies, what I need to bring into the room with me is a tracheostomy care kit, which I have. And I have a bottle of saline that I've checked the date, make sure it's not expired, and a bottle of peroxide. I also have some clean gloves. I'm going to need to take off the old dressing and the mask. And I have a red bag here. So first thing I'm going to do is I've kind of strategically placed the supplies so that I've got my fluids over here, my dressing kit here, and then I'm going to put my supplies over here too. So I'm going to loosen my tops, and actually I can just take them off. When you do take them off though, set the top down onto the table, not the rim, to keep that rim clean. So I'm going to take those off, get that ready, and then I'm going to open my kit. And just leave that ready to go. And there's inside the kit, you'll see there's some sterile gloves already there, so I'm going to use those sterile gloves. You could actually put on your own separate sterile gloves here if you want, but I kind of like that they're already in the kit for you to use. But first of all, I'm going to put my clean gloves on. And I'm going to put the bed up just a little bit. Put the side rail down. Okay, Mrs. Cross, I'm just going to take the mask off while I clean around that tracheostomy tube. I'm just going to set that on her chest. Now, if she had any difficulty with not having that oxygen on while I was doing the trach care, I could do it in piecemeal. I could maybe take the dressing off, clean the inner cannula, put that back in, and then give her some oxygen before I clean around, depending on what the patient needed. But at this point, she's doing okay. I'm going to leave my oxygen right there. I'm going to take off the old dressing and just assess to see what kind of drainage. Is there any blood there or any purulent drainage around there I need to document later on. I'm going to take that and wrap it up in my clean gloves, and then get ready to clean the inner cannula. Now, if the patient had a disposable inner cannula, which oftentimes patients will when they have a trach, then I would just be taking that inner cannula out and putting in another sterile inner cannula. But because she doesn't, we're going to clean the inside of that inner cannula and then reinsert it. So what I want to do is get my supplies ready. And the first thing that I'm going to do is put on my sterile gloves, which are laid out so that I can grab the cuff of the first one. Make sure I got my thumb going first. There it is. Okay, and then put my fingers underneath the cuff of the second glove. Kind of check out where that thumb is. Looks like it's right here. Okay, so now I've got my sterile gloves on. Now I'm going to start getting my supplies ready. There's a sterile drape that I'm going to use. And the sterile drape has a plastic side to it, and I want to put the plastic side down. So it's kind of hard to tell, but this is really the plastic side. And then I have a sterile field that I can put all my supplies on. So inside the kit are some, they look kind of like pipe cleaners, which you could use. We're not going to use for this purpose of this demonstration, but you could use that for cleaning if you wanted to. Just going to set that over there. We also have some Q-tips, which I will be using to clean around the trach, and a brush to clean the inner cannula with. There's a new dressing, so I'm going to put that on at the end, the new sterile trach dressing. And then I have a couple of 4x4s that we're going to use for cleaning, and I'm going to moisten some of those with saline and some of them with peroxide. I'm just going to lay these out. Okay, and then we have some trach ties, and I don't need these. The patient has a Velcro strap on around her trach, holding that in place. So we're just going to leave that and not replace it at this time. So I'm going to throw that away. So now I have my supplies all laid out, and now I want to put my solutions into the container so that I can moisten the supplies to use them. So the first thing I want to do is take and contaminate this left hand. So this hand will be contaminated, and I'm going to pour some saline into the small container. There's two containers here, or two holes, I should say, in the container. I'm going to pour the saline there, and in the larger portion, I'm going to pour the peroxide. So I have saline and peroxide. Now some trach care kits have 3 holes, so I could use the 3rd hole to put my sterile supplies that I moisten in afterwards. But I don't have that with this situation. So this hand is contaminated. Now I'm going to take my sterile hand and get my supplies ready for cleaning. First I want to take and do some peroxide. So I'm going to moisten this with peroxide. Put that right over here. Because peroxide is always first. You clean with peroxide. You could also dilute the peroxide. And depending on your protocol, wherever your policy, where you're at, they may require either not using peroxide at all. Some places don't use that anymore. Or using a diluted peroxide. So then I'm going to dip my Q-tip in there. So now I have a peroxide Q-tip and peroxide 4x4s. Now I'm going to take the other one and dip it in the saline. Okay, and that's going to go on clean second. So I'm going to put that second on my paper, on my sterile area. And there's my saline. And then I'm also going to be using the, I'm going to leave that right there, the sterile brush. So, first thing I want to do is take out my inner cannula. Now, you can touch the inner cannula on the outside with your clean hand. So I'm going to touch the outside with my clean hand, remove it, and then just set it into the peroxide for cleaning purposes. So that's in the peroxide. It should be bubbling and cleaning to loosen up the secretions. And now what I want to do is take my brush that I'm going to clean the inside of that inner cannula with my sterile hand at the bottom, because this is sterile, passing it to my clean hand. Because I can be clean up here, just need to be sterile down here. Okay, now I'm going to take out my inner cannula with my sterile hand. It's got... Now, I think this confuses students, so I just want to mention this. When you're picking this up, of course there's bacteria in there, because so it's not really a sterile environment anymore because you've got any bacteria from the patient in there. But it's not bacteria that the patient doesn't already have. You haven't touched the table and then touched this. So although it's contaminated, it isn't anything that you're not introducing any bacteria to the patient. So now I'm going to clean this, and I want to clean this over the trash. Or over this red bag, you could do that too. Clean that really well. And then I could just toss that away because I don't need that anymore. And then I want to take and rinse it with saline. And if you needed to, you could grab one of those extra 2x2s to wipe it dry. But we've got it pretty dry. We're just going to pass it to the clean hand and insert it that way. So the cleaning portion of the inner cannula is really the most important to remain sterility. Around here you still want to be sterile, but it's more of a clean technique than a sterile technique. So now I'm going to clean with peroxide first, and I'm going to use the Q-tip. I can either go underneath the faceplate, which is probably the best option because it's hard to get underneath the faceplate. Usually there's suture down on the sides, especially if it's a new tray. And it's tough to get underneath it, and it's important to clean underneath there. You have to touch the faceplate and lift it up so that you can get underneath and clean. With peroxide, and then I'm going to rinse that with saline. Just clean around there really good. And then I'm going to clean on top of the faceplate with my peroxide. Clean at the top, at the bottom. Okay, and then rinse it with saline. Top. And once I've cleaned the outer portion of the trach, then I want to reinsert a sterile trach dressing, which has got to go underneath the trach to keep it, to keep the area clean under there. And sometimes that's difficult to get under, but you gotta, sometimes what I do is take that Q-tip and kind of poke underneath with that if you need to get the new trach dressing on. Okay, and then you reapply your oxygen. Okay, Mrs. Cross, you're all set with the trach care. Take off my gloves. And wash my hands again. And then put the side rail up. And the bed down. Okay, I'll be checking on you later, Mrs. Cross. And this ends my trach care video.